Hi, I'm Ashley Davis. Today we will be discussing the location and function of various structures of the eye. We will also touch on glaucoma, macular degeneration, and retinoblastoma. I hope you enjoy. The first structure of the eye we will look at is the sclera. It is the thick, tough, white outer covering of the eyeball. It surrounds the eye here and goes all the way around here as well. The function of the sclera is to maintain the shape of the eye and offer protection for the eyeball. The cornea is a tough, clear covering over the iris and the pupil located in the front of the eye, here on the diagram. The function of the cornea is light refraction. Light bends as it passes through the cornea. This is the first step to making an image on the retina. The conjunctiva, located on the diagram here, is a layer of clear tissue that sits on top of the eye. It'll actually loop underneath the inside of the eyelid and form the back of the eyelid. The function of the conjunctiva is to protect the eye, and it sits right here on top of the sclera. Conjunctivitis occurs when the conjunctiva becomes inflamed. This is most commonly referred to as pink eye. It can occur in one or both eyes. Pink eye has a number of causes, including viruses, bacteria, allergies, or irritants. Pink eye, when caused by bacteria or viruses, is highly contagious. Bacterial conjunctivitis is treated with antibacterial eye drops, ointments, or pills. Viral conjunctivitis, much like a cold, must be allowed to run its course. The pupil, located in the center of the iris, is actually the anatomical lack of a structure. When looking at the eye, it is the center of the iris, which is the colored part of our eye. The size of the pupil will change to let different amounts of light through the eye. The iris, located here on the diagram and here, is the colored part of our eye. It is located behind the cornea and it surrounds the pupil. Its function is to adjust the size of the pupil opening according to how much light is in the environment. The ciliary body, located on the diagram here and here, is contiguous to the iris. It contains ciliary muscles and ligaments. The ciliary body pulls on the lens via zonules, which wrap around the lens. The ciliary body also produces aqueous humor, which is found in the front chambers of the eye. The lens is located in the anterior part of the eye. It sits directly behind the pupil. It bends or refracts light waves. The lens is responsible for focusing the light that enters the eye onto the retina. Without a lens, there would be no clear focused image for the brain to interpret. The aqueous humor, located here on the diagram, is the liquid in the anterior and posterior chambers of the eye, the posterior chamber being located here, and the anterior chamber being located here, right in the front of the eye. The function of the aqueous humor is to refract light rays and give shape to the eye. The canal of Schlemm, located right here on the diagram, is located in the angle between the cornea and the iris. Aqueous liquid exits out of the eye via this circular canal of Schlemm. Glaucoma usually occurs when pressure in the eye increases. This can happen if the eye fluid or aqueous humor isn't circulating normally in the front part of the eye. Two major types of glaucoma are open-angle glaucoma and angle closure glaucoma. In open-angle glaucoma, the structures of the eye appear normal, but the aqueous humor does not flow properly through the trabecular meshwork and canal of Schlemm. This kind of glaucoma is most common. Angle closure glaucoma occurs because of a sudden buildup of pressure in the eye. Drainage can be poor because of the angle between the iris and the cornea is too narrow. Glaucoma tends to be inherited and may not show up until later in life. The increased intraocular pressure can damage the optic nerve. Without treatment, glaucoma can cause permanent blindness. It is important to catch glaucoma early on so remaining vision can be maintained. There is no cure for glaucoma, but monitoring the eye pressure can help prevent further damage. The suspensory ligament is located between the iris and the ciliary body. It's a fibrous membrane containing the ciliary body and the lens of the eye, holding the lens in place. The ora serrata is where the retina meets up with the vascular tunic, or the vascular layer, coming back from the ciliary body. It has a serrated edge. Its main function is to secrete the aqueous humor and provide nutrients to the internal structures of the eye. The vitreous chamber, located here on the diagram, contains vitreous humor, which is a thick gel. Vitreous humor is no longer produced in the mature eye, unlike the aqueous humor. As we age, the jelly liquefies and bits break away to form floaters. The choroid is also called the vascular tunic. It is also one of the layers of the eye, shown on the diagram here. It is a layer in between the sclera and the retina. It contains the blood vessels that support the retina. The retina is also called the nervous or the retinal tunic. It is the innermost layer of the eye. It contains the nerve cells, rods and cones, and bipolar cells that make vision possible. Retinoblastoma is a rare tumor of childhood which arises from the retina. Although retinoblastoma is rare, it is the most common intraocular tumor in children. It is not usually present at birth, but occurs from infancy to 3 years. It can be inherited or sporadic in nature. A larger tumor can present as a white mass in the pupil, as you can see by looking at this photograph. This type of appearance in infancy demands immediate attention. The child should see an ophthalmologist right away. Until recently, removal of the affected eye was the most common treatment, with cure rates as high as 95%. Now, eye-sparing therapy is preferred to avoid psychological trauma. The macula is the slightly hyperpigmented area on the retina, located below the optic disc. Its function is central vision and color vision. Age-related macular degeneration is the most common cause of incurable blindness in the Western countries. Age-related macular degeneration is a bilateral disease with vision loss in the first eye occurring around 65 years of age. After that, the second eye gradually worsens and accounts for a large percent of visual impairments. There are 2 main types of age-related macular degeneration, wet and dry. Blindness is usually associated with the wet form of age-related macular degeneration. Older patients complain of a blurring of their vision and an inability to read. One eye is usually considerably more affected. Since this degeneration is limited to the macula, the peripheral fields are unaffected. This means that the patient can walk around normally. Reading, driving, and difficulty recognizing faces are common complaints. Wet age-related macular degeneration occurs more in Caucasians, and of those cases, about 1/3 give a family history account. In the dry form of age-related macular degeneration, cellular debris called drusen, or tiny yellow or white accumulations of extracellular material, accumulates between the retina and the choroid. This can cause the retina to detach. In the wet form of age-related macular degeneration, there is abnormal blood vessel growth through Bruch's membrane, which leads to blood and protein leakage below the macula. Bleeding, leaking, and scarring from these blood vessels further destroys central vision permanently. The fovea centralis is located in the middle of the macula. We have the best focused central vision here. Also, the largest number of cones are located here. The optic disc is the area on the retina where the optic nerve is leaving the eye. This leaves you with a blind spot in each eye. This is because there are no light-sensitive cells on the optic disc. The optic nerve meets the posterior part of the globe, slightly nasal and slightly above the horizontal meridian. The optic nerve carries the electrical stimulus to the occipital lobe of the brain for interpretation. Thank you for watching. Today we have discussed various parts of the eye, including their location and function. We also touched on 3 diseases of the eye, including glaucoma, retinoblastoma, and macular degeneration.